I'm Jocelyn Wittstein. I'm an orthopedic surgeon at Duke. I specialize in sports medicine. My background is I trained in orthopedic surgery, sports medicine at Duke. I've practiced for several years in Cooperstown, New York. I've been a team physician for 2 colleges there, including men's and women's soccer, including Division I soccer. I was myself a collegiate Division I athlete, and I'm a lifelong athlete, but more importantly, I'm the mother of 5 athletes. I'm very interested in community education, teaching, injury prevention research, particularly in regards to ACL injury prevention. Dr. Lassiter also happens to be my husband. He is also a professor of orthopedic surgery at Duke, specializing in sports medicine. He's also been team physician at ECU. He has degrees from Duke, training in orthopedic surgery, undergrad and MHA at UNC. So he really doesn't know who to pull for during football season. Melissa Raditz, our nurse practitioner, is here. She works with us. She treats adolescents and adults. She's herself a Division I college athlete, an elite level marathon runner, and has worked at Columbia, HSS, Cornell Weill, and Memorial Sloan Kettering. Michael Messer here up front is our PT, who is basically a kind of a delegate of FIFA. He's affiliated with that organization, is an expert in injury prevention and education on that subject, including the FIFA 11 injury prevention program. He's also the physical therapist working with U.S. men's national team. We have some pictures of him up there. Janna Fonseca here, we introduced. Duke is a FIFA Center of Excellence, and if you're wondering what that means, it means that we provide excellence in care of soccer-related injuries, as well as excellence in research on injury prevention and treatment of soccer-related injuries. And there are only 3 of them in the United States. The others are HSS in New York, and then there's another one in Santa Monica, California. So we're the closest one to you, and we're also available in Raleigh, Wake Forest, Knightdale, as well as in Durham. So overall, I'm going to have Janna start with some discussion of concussions, and then we're going to transition back to the more orthopedic musculoskeletal aspect of things, focusing a bit on ACL injury prevention. And Michael and I are going to work together to kind of go through the FIFA 11 injury prevention program, which is a very effective way to help prevent knee injuries. So I'm going to kind of let Janna speak to you guys, and then I will take over again.
Thank you so much. So like Dr. Wittstein said, my name's Janna Fonseca. I am an athletic trainer by trade, even though right now I'm working as an administrative manager for the whole division of sports medicine. But one of my clinical passions is concussion. So I wanted to take just a few minutes to talk a little bit about what a concussion is, what some common signs and symptoms are to look for, and then what should be done to treat these injuries, knowing what we know now in 2018 as it pertains to sports medicine. So a concussion is a traumatic brain injury. It falls on the spectrum of being a mild traumatic brain injury, but it is still a traumatic brain injury. And the working definition that we as sports medicine professionals use is a complex pathophysiological process that affects the brain induced by traumatic biomechanical forces. So that could be ball to head, that could be ball to ground. It also could be a situation where it's body to body and the head doesn't actually strike anything, but there's enough force that's transmitted through the body that causes the brain to move inside the skull. So it can kind of be one of those more non-traditional mechanisms, but that can still result in that brain movement and result in those the signs and symptoms. So there's certain characteristics that we look for. Like I said, it could be a blow to the head or it could be a blow somewhere else to the body. Generally, those symptoms show up within a few minutes. They may also develop over the course of a few hours. You might not notice symptoms until the day following an injury when you try to stress your body, or where your son or your daughter tries to stress himself or herself by going to school or trying to go to do some form of practice or some form of exercise. So generally those symptoms show up relatively quickly, but they eventually resolve over time, and that's what makes this, again, a mild brain injury. Generally, those clinical signs and symptoms reflect a functional injury. That being said, or meaning that if you go to, an urgent care or the emergency room, if you have some of these signs or symptoms, and a CT scan is ordered, that CT scan very much is going to look normal because there's no structural injury. This injury is a metabolic injury that occurs at the cellular level that does not show up on these common imaging, neuroimaging such as MRI or CT scan. And again, it can be loss of consciousness. It doesn't have to be loss of consciousness. Sometimes people used to think that if you lost consciousness, that means you're concussed, but you can come out of it and not have any signs and symptoms. loss of consciousness is not the only sign that we look for when it comes to recognizing a concussion. So we know it's a metabolic injury. We know that it does not show up on CT scan, and we know that these signs and symptoms can kind of present in 4 different categories. They can be physical, so things like headache, dizziness, nausea, vomiting, repeated vomiting, sensitivity to light, sensitivity to noise. They can be cognitive, so people feeling like they can't concentrate or they can't focus, they feel like they're mentally foggy or they're in a fog or in a daze or in a haze. They might not be able to answer questions quickly, they might seem slow to respond. They can also manifest themselves, these signs or symptoms, in emotional ways. People might be more emotional than usual, they might react to things inappropriately, they might seem more sad or more irritable than usual. And then we also know that concussion can affect sleep. You might have somebody that sleeps a lot more than usual, or you might have somebody that doesn't sleep as much as usual because of those signs and symptoms that are keeping them from sleeping. So those are very common things that you can be on the lookout for as a parent or a coach, especially following any type of mechanism like I described before. So the main kind of take-home points from this are, if you suspect a concussion, it's best to remove that athlete from play and do not allow them to return the same day. If they do return while they're still symptomatic and they sustain another blow to the head, they might sustain what's considered second impact syndrome, which is sudden irreversible brain swelling that can lead to catastrophic results such as lifetime impairment or even death. So that's why we're so careful and cognizant about intervening appropriately once we suspect a concussion has occurred. So no same-day return to play. And generally, we want to see these athletes evaluated by a healthcare professional with knowledge in concussion management. So to take them through a full battery of tests. And we'll be handing out some informational material and a hotline phone number that you guys can call in order to have that evaluation take place. Some things that we do look for as far as when is it appropriate to call 911 versus when is it appropriate to simply kind of take my child to a healthcare professional or a physician with training in concussion management. If there is any type of suspected neck injury where there's, I can't move my arms, I can't move my legs, I can't feel my hands, obviously that's a time where you would want to call 911. If there's significant disorientation and your athlete is not able to recognize you or people that they should know or where they are, that's a reason to call 911. And a headache that gets severely, progressively worse over time. Again, if they've been removed and my headache, it's killing me, it's getting worse and worse, and they're unable to recognize where they are, those are all reasons that you would want to call 911. Again, going to a healthcare professional with training in concussion management is going to help that athlete return to both school as well as sports in a safe and timely manner. And we've seen a huge shift in making sure that athletes are returned to the classroom in a safe and timely manner. So making sure that the appropriate steps and progressions are taken once these injuries occur really allows them to be back in the classroom and back on the field in a safe and timely manner. So that is just my brief spiel about concussions. Does anybody have any questions about that now? Yes. So the question was if there's is there a severity scale that defines concussion? And as a healthcare professional, we actually don't really grade them anymore now until that concussion is resolved, because one of the things that we use to define how severe the injury is how long it takes that person to get better. So it's very difficult to give it a classification early on in the injury process. So generally it's yes, you're concussed, or no, you're not. But one thing that we are learning a little bit more is there's different kind of subtypes of concussions. This is kind of research coming out of the University of Pittsburgh Medical Center, where yes, you're concussed, but you might be demonstrating signs and symptoms that are more consistent with a cognitive fatigue type of concussion versus like a post-traumatic migraine versus like a vestibulo-ocular type of concussion. And there's a lot of overlap with all of those, but we're getting better about kind of weeding out the differences and then also putting the appropriate treatment interventions into play. So does that answer your question? Okay.
So at this point, we'll move on to the knee injury prevention aspect of this. I'm just going to give you a little background information about ACL risk associated with soccer, what we can do to reduce risk, what are injury prevention strategies, and what are some current concepts and how we treat ACL tears. So when ACL tears occur, they're usually an acute injury, usually a non-contact injury. There's usually a player kind of on their own, running, stopping, planning to change direction, and they feel a pop and have swelling in their knee. And when you get an MRI, there's this bruising of the bone, there's rupture of the ligament. This occurs in a large number of athletes in cutting and pivoting sports. Soccer is one of the more at-risk sports, followed by basketball. People think football would be the one that's the bad actor, but actually soccer is pretty common. So there's a big focus in preventing these injuries. We think they're increasing in frequency due to increased athletic participation, more aggressiveness in sports. More hours of exposure. People are playing in multiple leagues, they're playing year-round, and just the sheer exposure could increase the incidence of this. So we also have a problem when people tear their ACL and we treat them surgically. You go back to at-risk activity, and this can lead to re-injury. And there's about a 20% chance of either re-injuring your knee or your other normal knee. So we really want to get people into injury prevention to help minimize this risk. If you've had a prior injury, you have almost 40 times the likelihood of having another injury as compared to your uninjured, cohort. When we look at return to sport, we see about 20% sometimes re-tear of ACL reconstructed grafts. So some of the same things that can prevent injury could also help reduce the re-injury rate. There's a lot of things we're doing surgically now that we didn't do 10 years ago that are also reducing that re-injury rate, but we need to, kind of get at it on the front end and reduce risk as much as possible through training. So the ways we, reduce knee injury rates, such as ACL tears and re-injury rates, are maybe we could screen for people who would injure themselves. And it turns out the screening mechanisms are not so great. It's unclear. There's some, data that says we can identify at-risk people, with high predictability. And some data says, well, we can kind of tell who might get injured, but it's not so clear that we can say these are the people who need preventative work. It's more like we need to reach out to everybody. Neuromuscular training, that's what we're here to talk to you about today. Injury prevention, dynamic warm-up. There is good evidence that this helps, and it helps a lot. So that's what we're going to focus on once I get through some of this other information. Like I said, there's things that we're doing surgically. We're doing more anatomic ACL reconstruction. That's likely to reduce graft failure rates when you do an ACL reconstruction. And sometimes when someone's had a re-injury, we'll do things like, new procedures like add something called an anterolateral ligament, which isn't in the scope of this discussion, but those are other things we're doing that can reduce re-injury rates. So predicting injuries. There are some authors who have published on this that there are very predictable screening mechanisms, like doing a drop landing and looking to see what position the knees are in. This author in particular, Dr. Hewitt, has published on this. Others have tried to reproduce it, and they've said, well, when people jump and land and their knees collapse inward, it's kind of predictive of risk of injury, but not high enough to be a good screening tool. So that leads us to, what else can we look at? We have seen that people that have weak hip external rotators and weak hip abductors are more likely to injure themselves. But still, we're really trying to focus more on just incorporating injury prevention into your regular training, because that's the best way to get to the most people and reduce risk in the greatest degree possible. This study here is a meta-analysis. That means they looked at all the data on injury prevention programs, which are basically consistent, showing there is a significant reduction in risk when we include a dynamic warm-up program that has certain components, and we're going to go through a common one of those. We want to see, as a result of the work we do in our injury prevention programs, which again we're going to go over in a bit, we want to see controlled landings with soft knees. We want to reduce impact, and we want the knees to be generally flexed as well as the hips flexed rather than landing and extension. We're going to go through some good and bad examples. They may be demonstrated by my daughter, who's going to demo them, but of what your knees should look like when you're landing and squatting. What we see when we look at data on injury prevention programs is they can reduce knee injury or lower extremity injury by up to 50% when we look at severe injuries. And that's a pretty impressive number. This requires 2 to 3 sessions a week that take about 20 minutes, so about an hour a week of investment in your time to reduce your injury rate in terms of severe injuries by 50%. This is dose dependent. So, the more you participate in this, the better the effectiveness of it. If you do it pre-season, that's more effective than doing it just when you're in season. So that kind of makes sense. So the blue line is injury rates among groups participating in a dynamic warm-up program that's an injury prevention program. The gray line is those not participating in this program that we're going to demonstrate for you. There's obvious reduction of in-game and in-training injuries. So what's included in these programs? There are some components of strength, plyometrics, agility, flexibility, and balance. Flexibility really involves stretching. That's sort of in your cool down. We're not going to focus on that today. Stretching is actually not really part of the dynamic warm-up. Really, the dynamic warm-up focuses on strength, plyometrics, agility, and balance. Important point about this should be supervised. There should be someone who is somewhat knowledgeable about the injury prevention program. This may be a coach that's been trained and educated. It may be an athletic trainer, physical therapist that's working with the athlete. And there needs to be feedback to the athlete. They can't just go through the program and do the exercises and not get feedback about what they can improve on, what they need to correct. Because part of the point of doing the exercises is to identify areas of weakness. The flexibility we talked about is really working on stretching as part of the cool down process. There are added benefits to these programs, including increased strength, improved performance, less loss of time out of play due to reduced injury. So overall, prevention is key. That's why we're focusing on it today. We talked about how much time you need to devote to this and the 50% reduction in injury. So with that, I want to demonstrate to you guys what is the FIFA 11 Plus program. It is a dynamic warm-up program that has a series of exercises broken into 3 main parts with 3 levels of difficulty, so to speak. So there's a beginner level, there's an intermediate level, and there's a more advanced level. And depending on where the athlete is at, they may be at a certain level of difficulty within those exercises, and then they can progress through it as they get more skilled at them. But again, this is something they're going to do in the preseason, during season, and try to do this 3 days a week. So we'll go through the parts, and Michael is going to help demonstrate with Chloe how this goes. Now, the demonstration may take a bit more than 20 minutes because we're going to give you a little bit of feedback. We're not going to go through every level of difficulty, but you'll get an idea of what is included in this program. And it's certainly feasible to include this in a practice. It's certainly feasible to include a shortened version of this in a pregame warm-up. And really, there are things that there's benefit to including regardless. So a lot of focus as you go through each exercise and that feedback that the athlete needs is, are they landing or doing these exercises with proper body position? That's a major focus of this activity. So Michael's going to kind of comment on some of these as we go. But in general, you want to avoid inward collapse of the knee, what we call like internal rotation of the hip and lack of abduction. And we want some alignment, from the side. We don't want... We want our shoulders to be over our knees, to be over our toes, essentially. If you were a coach and trying to set this up, this would be what your field would look like. You'd have some rows of cones. This is a partner exercise. It's meant to be included in a team activity, and that is also another benefit of it. So you use 2 cones, and I have this sort of set up for you here, 2 lanes down the middle, and then you jog back on the outside. So the first part is easy. It's a simple warm-up. It's just jogging straight ahead, and this is at a light pace. This is not a sprint or anything like a maximal effort. So you're just going to jog down, and then she would jog back, and there would be another person paired up with her. Again, simple motion, but if you're looking at someone from the front when they're running, they shouldn't be collapsing inward with their knee. How'd she do?
That right knee.
Right, yeah, her right knee a little bit collapsing inward. We ran through this last week, so we already picked on her a bit. So, okay. Number 2 is you might do this in your practice. You might hear it referred to as open the gate, but it's you sort of jog to each cone and then you stop and open the gate with your head.
Can I say one thing?
Yeah.
So for those of you that play, a lot of the things that you see in this today will probably look fairly familiar. And a lot of coaches, even players, just kind of know these are some of the things you associate with a soccer warm-up. But the key point from what we're talking about today is it's not just doing it, it's about how you do it. So I'll go out, I'll watch a soccer practice, a soccer game, and I see some of these things, but there's kids out there kind of like, how many of you guys recognize that from your practices? Does that look pretty familiar? So it's not just doing what's up here, but it's about how you do it. So as we go through, really pay attention to some of the cues for what it's supposed to look like, because that's how you get the benefit from it. So Chloe, go ahead and continue.
So keeping the pelvis level, not like, drooping over to one side, and then you can jog back. Yeah. So kind of in the image there, the correct one on the left, the pelvis is level. On the right, there's some leaning, there's some inward collapse of the knees. Those would be things you would look for in terms of like detecting weakness. So the next one is similar, but now it's, we call it closing the gate. So instead of flexing and rotating out, she's going to bring it in. So. Keep going. Good. And again, we want the pelvis to stay level and the leg that's bearing the weight to not collapse inward at the knee. That's good. You can run back, though. She's pretty good at those, I think. Yeah, okay. All right. So in this one, a little confusing to explain, but it's running with circling your partner. So, you would do this with a partner. You would kind of run to the next cone, and then you would circle each other. And then you would run to the next cone and circle each other. So it's just a little bit of agility, kind of. So you guys want to try to demonstrate this? That's right. So there's, kind of getting warmed up with a little side-to-side motion, awareness of where other players are, that kind of thing. Okay. This one's also kind of fun. You can see how this would engender some sort of team camaraderie. It's running with shoulder contact. So you start to progressively see little exercises where you're sort of having some perturbation of balance, or something sort of that could get you a little bit off balance, and then continue onward. So they're going to jog, shoulder. Now Michael's got a little bit of an advantage over Chloe, but she's pretty tough. So we'll see how it goes. So they're going to jog and do a shoulder-to-shoulder contact. So they're kind of like bump each other. You jump up and bump each other. Jump. And then they run. And at the next cone, they do it again. So they kind of rebound off each other, land, and keep jogging. Okay.
Now, real quick. So
yeah.
Did anybody notice any differences between what I did versus what Chloe did? Did you see that a little bit?
Right.
And then was she a little more upright when she landed, as opposed to kind of sitting down into it? So again, just something to pick at as we go.
So Michael's sort of taking off and pushing over and then landing with soft knees. And Chloe, because she's not as practiced at it, was sort of leaning, like listing over into him and then kind of landing a little bit buckled over. So, all right, but not bad. You haven't done this very much. Okay, running quick forwards and backwards, fairly self-explanatory, but again, when someone is watching your athlete do this, they're looking for that posture of the knee, so to speak. Do you want to run forwards and back? So run down and then back pedal, right? And in the actual handbook, which we can share a copy of this, you run forward and then back one cone and then run forward and back one cone. So it's kind of like a progression of running down to a cone and back, running down a couple and back one, but running forwards and backwards, so getting some of that back pedaling in. All right, this gets into the harder part, some of the strength and plyometrics. This is where you have the 3 different levels. So this is for core stability. This is called the bench. They're the easiest to hardest. There's a static bench, there's a alternating legs bench, and then there's a lift and hold. So do you want to demonstrate just the static bench? Yeah, just a plank, basically. So, so that's not bad. Now show them alternating legs. And keep your butt down. Yeah. Okay, and then the hardest one, you would hold it like 30 seconds at a time. So she would hold one and try not to let her hips rotate, try to keep them level, try to keep her butt from going up in the air, and then try not to sag in her lower back. So Michael's kind of giving her a little feedback about the error she's making. And it's pretty hard if you've never done it. Actually, if you just want to get in a workout as an adult, you could do this injury prevention program a few days a week. It's pretty good. Okay, that's good, Chloe. All right. So, next one is the sideways bench. So this one, again, easiest to hardest. On this slide, I have for you the correct version on the left, the sort of errors on the right. The sideways bench is basically a side plank on your elbow. You go from just holding it to raising and lowering your hips off the ground to doing a leg raise out to the side. The key things are here. You want to obviously not sag in the middle, so you're using your hip abductors to keep your hip off the ground. And then you're using your core to avoid rotating forward. So the tendency would be to rotate forwards to your forearm, but you want to stay straight up and down. So it involves the core and your hip abductor. Now that's the easy level. Do you want to try the straight legs out and raise your hips up and down, or do you want Michael to demonstrate it? Okay. So this one's pretty hard. So this would be level 2 of this. So he's going to raise and lower the hips. So that's using a lot of abductor and core work. And then the highest level of difficulty would be the holding it and leg raises. So that's the most advanced level. So, all right. So he's pretty good at that. Yeah. Okay. So this is definitely a partner exercise. This is, you may have heard of a Nordic hamstring curl. It's similar to that. We're doing just the lowering down version of it. So basically, the way this progresses in level of difficulty is you just do more reps. So when your athlete is just learning how to do this, they might just do 5 reps, and then you build up to something like 12 to 15. But basically, the partner holds the ankles down while the athlete is leaning forward and trying not to bend at the hips or the waist. So you're really isolating the hamstrings. They lower down as far as they can and then catch themselves. Good. So you just go as slow as you can until you can't slow yourself down anymore with your hamstrings, and then catch yourself. And again, you just advance in difficulty by doing more repetitions of that. But that's a really good hamstring strengthening exercise. Next one is the single leg stance. The easiest version of this is simply holding a ball and balancing. We then progress to throwing a ball back and forth to your partner, and then a shared sort of balance disruption where you're kind of tapping each other back and forth. So they're kind of already on to the second level. And you can try, you're going to do it on both sides. You're going to try one side then the other. And you'll find that you're better at balancing on one side than the other based on oftentimes your abductor strength. So they're just sort of at the highest level, kind of tapping each other to get themselves a little bit off balance and trying to maintain that single leg stance. Okay. I won't tell you what Chloe did to Michael the first time she tried this. Just basically push him as hard as she could. So, okay, so next is squats. Proper squatting technique leads to really, proper landing technique as well. And this is a really important thing to visualize in athletes. There's so many athletes that squat with this sort of inward collapse of their knees and have really poor technique. So the first level of this is a simple squat to a toe raise, and then the next level is walking lunges, and then single leg squats, which are really pretty challenging. So do you want to face this way, Chloe, and stand in the middle and face that way? And so show us a squat to going up on your tiptoes. So squat down, not a jump. Michael will do it with you. Squat and toe raise, up on your toes. So as she's going down, you want to keep your, basically knees going straight over your toes, and up, and not collapsing inwards, not getting out too far in front of the feet. So she's getting a little far forward, right? She's a little bit pitched forward over her toes, but not bad. Okay. So, do you want to talk about the lunges or demonstrate that? So you want to lunge down? Yeah. So with the lunges, you want a 90-degree angle of both knees. So you're stepping a little far. Yeah, that's good. Don't step quite as far. Pretty good. That's good. So you want 90-degree angles. That's good. Okay, that's good. And again, you want with your lunge, your knee to go directly over the toe, and we don't really want the knee to extend past the toes. Now this is a combined partner exercise. This is the more difficult level. They're doing single leg squats. I do this a lot with patients in clinic to see how their strength compares side to side, because a lot of people on one side will have a lot worse control and a lot more inward collapse of their knee in a single leg squat. Good. And again, someone would be watching and giving some feedback about any abnormalities there. Jumping, so we progress from a vertical jump to lateral jumps to box jumps. So vertical jump is simply taking off and landing and trying to land with proper position of the knees. So you can stand here and face forward. Just jump up and land. Okay. Any feedback for her?
So just what we talked about before when we did the shoulder contact. Chloe, why don't you face that way? So no.
In the middle, yeah. Face Michael.
There, you're good. And then do the jump in place again.
Jump and land.
You did better that time.
Yeah.
So the first jump, again, just a little more through the knees and not as much through the hips. So we want to see her absorb through the hips too. One more.
And
good.
Yeah, good. So she's absorbing force through flexion of the hips and the knees, soft landing, not landing with rigid knees. Lateral jumping is sort of a side-to-side jump. You want to face forward and
face in.
Yeah. So taking off on one leg and landing on the other. And try to sort of control your landing on each side. So this kind of involves balance, hip abductor strength, a little coordination here. It's pretty good. Yeah. And then box jumps are basically jumping in a square. So it's a forward jump, a side jump, a back jump, a side jump, a forward jump. So you're kind of creating a box when you're jumping and trying to maintain the good position of the knees while doing that. Now you wouldn't be doing all three of these levels as you progress. So it wouldn't take this long. You would see like where the athlete is at, at what level. And do you want to demonstrate that one? So forwards, backwards, side, and forwards. So, for most pretty athletic people, they're probably, wouldn't you say for the most part, high-level players are doing these at the higher level, the more complex level, unless they're not able to strength-wise. So you just want to make sure whatever you're doing with good form and doing it properly. So this gets to sort of the final set of exercises, which you're doing at more of a sprint pace. So there's a few of these things. One is just running across the pitch. So they're going to go kind of 75 to 80% max speed. They're going to do 2 sets of running across the field and then they jog back. So sprint across, jog back. Do you want to sprint for us? And she would jog back. It'll be a little wider because it'll be going all the way across the field. Bounding, so this is more of a bigger spread of each step. So there's some more hip flexion. You're pushing off. You're swinging the arms more. It's a very kind of dynamic, big forward step. You want to try that? Right. And you would do that for 2 sets and jog back. And then the running plant and cut is sort of obviously progressing more towards like what you're actually doing in soccer. So it involves sprinting between the cones. So you would sprint to a cone, plant, cut to the other side, sprint forward, plant, cut to the other side, and you would do that across the pitch, jog back, and then repeat that. The idea is you sprint for about 5 steps, decelerate, change direction, sprint, decelerate, change direction. So again, 2 to 3 times a week. Once the team gets practiced at this should take about 20 minutes. You may progress up to the higher level of difficulty as you get better or more trained at it, and you're able to do it with good form. Shows about 50% injury reduction. And so I just want to say thanks. Thanks to Soccer Genome for letting us educate you here today. We're happy to take questions. We're happy to kind of go through some of the exercises with you one-on-one if you want. We have some handouts that sort of go through the whole program. All right, well, thanks, everybody.